I'm here with Dr. Jeremy Springer, the clinic practice director at Creekside Family Medicine, Park Nicollet, and I wanted to ask you about advanced care planning. What is an advanced care directive?
Well, it's your plan for what you think should happen to you, or directions for those of us who are going to be taking care of you when you can't tell us anymore what you want to have done. So it's planning in advance for those times when you're not able to tell us how we should take care of you.
And why should someone complete an advanced care directive?
Well, we all, or not all, but many of us find that as we go through life, things happen to us. And again, there are times when we interact with medicine, with people taking care of us medically, and we, for whatever reason, are unable to put our wishes out there. So having a plan for that, or having appointed someone to help make those decisions, is a smart thing to do.
If I have an advanced care directive filled out, when might that be used?
Well, as long as you can make your own decisions, then we don't use your advanced care directive. But if you're in a situation where you can't communicate or are unable to let us know what your decision is at that time, then we would fall back to your advanced care directive to help us understand what you would want to do in that situation.
Can I change my mind?
Anytime. You can change your advanced care directive every day if you want. It's a little cumbersome, but you can do it every day if you want. But no, we can change that at any time. It's not written in stone that it can never be changed.
Why do you think it's important to have an advanced care directive?
Well, I think things happen to us that are unexpected, and having been in this job for a while now, I've experienced it where patients are doing very, very well, and then suddenly have something happens and they can't let us know what we should do next for them. And without some prior planning, we're left to make that decision for them, and we're not necessarily the best ones to do that. And I think people have fears of being on ventilators or not being on ventilators or whatever, and it would be good for us to understand what their feelings are and what they want done for them.
Okay, well, thank you for your time, Dr.
You're welcome.
Springer. I'm here with Dr. Teresa Quinn, one of the family medicine physicians at Creekside Family Medicine, Park Nicollet, who specializes in the field of geriatrics. And I wanted to ask you more about advanced care planning. Specifically, what is a healthcare agent?
Well, the healthcare agent is the person that you choose to speak for you if you cannot speak for yourself. For example, if someone's in an auto accident and they're unconscious and they can't speak to their doctor, then their healthcare agent could speak for them.
And if I'm thinking about designating somebody as my healthcare agent, who should I consider that to be?
Well, you can choose anyone you want. Of course, you want to talk it over with that person before putting them down as your healthcare agent. Some people choose a family member, but you don't have to. People often think you have to choose your spouse, and you can do that, but you don't have to do that. As people get older, often they'll choose their children. But again, you can choose anyone, a close friend, a cousin, anyone that you think could do a good job for you to speak for you when you can't speak for yourself. And then it's important to talk to that person about what your wishes would be. You know, if say you're unconscious and there's no hope of you recovering, what would you want done? Or if you're unconscious maybe for a short time and there is a good hope of you recovering, you know, again, what would you like?
Once I designate a healthcare agent to speak on my behalf or fill out an advanced care directive, how will my physicians see that information?
Well, there's a form on the advanced care planning where you can name your healthcare agent and have that notarized. And then you could bring a copy of that to your physician and make sure that they put that in your chart. Also, of course, you want to tell the healthcare agent and keep a copy for yourself.
And I know specifically in electronic medical record, I believe there's an area that will mark that information is filled out, so direct the physician to that information. How do you think advanced care directives and designated healthcare agents have helped your patients and families?
Well, I see a lot of people who have been hospitalized and then are in the nursing home for a short period of time to recover. And often during that time, they're unable to speak clearly. They're still recovering from a serious illness, or maybe they've had a stroke. And their healthcare agent will advise us as to how much that person wants done. You know, some people want comfort care, some people want to be rehospitalized if there's a major problem. So we will talk that over with the healthcare agent when the patient cannot speak. A lot of times our patients will recover and then they are able to speak for themselves again.
Well, thank you for your time today. If I'm interested in filling out an advanced care directive or, appointing a healthcare agent for myself, who should I talk to about that, or how do I go about doing that?
Well, you can talk to your physician at any office visit or put in a phone call. You can talk with our healthcare home coordinator, Jenna Phelan. You can talk to any of the nurses. They have forms at our clinic. So I think that'd be a good start.
Okay, well, thank you.
I'm going to go back to my own phone calls.
Okay, today I'm sitting here with Dr. Amber Scaletta. She's the chief resident at the Creekside Family Medicine Park Nicollet Clinic. And I wanted to ask her a little bit about advanced care directives and the planning process. And Dr. Scaletta, why do you think it's important to have an advanced care directive?
Well, an advanced care directive is an important tool that patients can use to help identify and communicate their goals and values to their doctors, their care team, and also their other family members. If a patient finds that they're unable to tell a doctor or their care team what their goals of life are, what their goals of care are, then it's really difficult for the care team to know. However, with an advanced directive, if you're able to write down your goals and values ahead of time, it's a great way to ensure that your preferences are carried out if you're unable to talk.
Okay. Let's say I fill out an advanced care directive and I change my mind. Can I make changes?
Absolutely. As time goes on, as things change in your life, it's very, very common that goals and values and beliefs change, your preferences change. It's absolutely fine to change your advanced directive at any time.
Let's say I'm a patient here at the clinic and I'm interested in finding out more about the advanced care directive, the planning. How should I go about doing that?
Good question. There's a couple of different ways. We can certainly give you some printed information that you can read. You can certainly always talk to your doctor about it. All doctors are aware of what advanced care directives are and can answer your questions. We also have some counselors who are specially trained to help you fill out an advanced care directive, so you can make a meeting with one of them and you can either call the clinic or ask your doctor or nurse to help set you up with that too, and they can answer detailed questions for you and can sit down with you for quite a while and help you fill it out.
Is there a certain age that I should consider an advanced care directive, or?
There's really not too young of an age specifically. Usually we say adults, should think about filling out an advanced care directive. Even if you're a young adult in your 20s and 30s, it's a good idea to think about and to fill one out and let your family members know what you would want if you were unable to make medical decisions for yourself. So there's no age limit.
Okay, well, that's great. I know being the chief resident, Dr. Scaletta, you're very busy, and I appreciate you taking some time out of your schedule And it really shows how important this initiative is to you. So thanks again.
Yes.